cool. All right, so here we go. Just tell me when we're shooting.
Yep, all good.
All right, cool. So here we go. We're using a scraping tool. Yeah, some people call this like Graston technique. This is not a Graston tool, and I haven't taken any Graston classes, so we can't use that term. But it's tool assisted release, and we're working on the foot of a collegiate runner, and there's been a number of traumas that have happened to this foot. What was the official diagnosis there?
It was a tear in the peroneal brevis tendon.
So you all know peroneal brevis comes around the side here and then attaches in through here. But we find that getting all the way around, so a lot of times they'll call this technique like framing. And what you do is you just get to the mortise joint and you work all the way around it. So I'm just getting in through here. Now I'm going to go underneath the lateral malleoli here. And I can go up, but I find like kind of sweeping down. What I do is I'm just feeling the tool, and what gives me the greatest crunchy effect, so to speak, like right through there. Feel those marbles right through there, Cam?
Yeah, it's crunchy.
Yeah, so we're just getting in there, and then I'm just taking the edge of this tool. This is a flat, this kind of got more of a blunted edge to it. This is where that kind of knife edge might work a little bit better for you. I like it because I think it keeps it a little safer too, because sometimes the depth of penetration is a little bit too hard. So I think this is good. And I'm going to just go all the way around working this guy out. Oh, yeah. Now we're going to get through these tendons here in just a second. But first, let me trace that joint. It's kind of, you got to have discipline with this, because when you go through it, you're like all of a sudden get like, literally, they can probably see that on the film, how that's vibrating like that. And you want to you want to jump to that, but that's another protocol altogether. So wait, stay with it. Just keep tracing the mortise joint first. Then I'm going to go around to this side. And get this stuff. If you can sweep up occasionally to help circulation and help it return to circulation, I think that's a good way to do it too. I'm going all the way around here, just working all of this stuff out. I'm just getting in here. Ooh. Here's another one right through there. And I'm just bringing that to me. I'm going to get nice and smooth. Get all that stuff. I can just feel it coming out. I can hear that. Yeah, right through there. Yeah, get all of that. And then after a while, it's going to feel like either it's going to release, or it might not release, but it's going to have like a different quality to it. There it goes. There it goes. It starts to soften some. It's not quite as snappy. Once you feel a change in the level of snappiness, then you finish off with a few cleansing strokes. Get that stuff you just released and then return it back to circulation. Then you start again, and we get through here. And I'm going around here. Pretty clean there. You've done a great job cleaning out that stuff. Now remember, this area is really important. This area right through here, from this malleolus to the calcaneus here, you got a lot of tendons that run through, and you've all heard of the carpal tunnel here. This is a tarsal tunnel right through here. So getting in here, and then I like to take some of those tendons there, and a lot of times I'll just go right back to my hand and maybe some active release there for a second, and I'll take the tendons, and then while you're curling your toe a little bit, getting that flexion in there, I feel like that's a good way to release those points there. And I'll just again, and you could see he's got great foot anatomy, guys, so you could see how we're just going right through there, tracing that good, and then getting right in there. Now the foot's starting to drop. Sometimes with a little external rotation it drops a little bit, and that's not uncommon for us to have altered foot mechanics when we're healing from something on the outside. So we're going to go ahead, we're going to do a little bit of a release right there too. So we're going to find this bone right here, and then I'm going to go ahead and gently have you pull your knee up to your chest. Just, oh, it sucks. You can hear the breathing going on. You're doing good. And push. Woo. And release, and we're getting right through this. And push. I love to see what other therapists, how you all go after attacking all the adhesion in this area. It's great. But hey, we had about a little 5-minute snap it. And we have a future physical therapist with us filming, so we're like, hey, let's get after it. It'll be fun. Go ahead and pull. Great. pull up. Good. Nice. Now, remember, we can't forget when I was over here. So this is, you can also frame the calcaneus there as well. So you just go back and get that calcaneus there. So I love, again, working in through here. And it's taking that tool and getting in there, getting after that. Now I got a little Achilles tendon involvement there too.
So I had a lot of fluid in there too.
Yeah.
MRI and that calcaneus.
Yeah. So
I find this was super helpful with that.
Yeah. So getting this here, and again, I think it's important, like, because a lot of our strokes are downstrokes, which might be drawing fluid to pull here. So I think it's okay to release adhesions, but then afterwards, I think, for lack of a better term, I'm just calling them cleansing strokes, but just to kind of just start to make sure, or you may even elevating the foot afterwards. Now I'm going to go all the way around the calcaneus like this and just get in. And I imagine this would be a good technique. I use a similar technique for folks like with chronic plantar fasciitis or heel spurs, things like that. Obviously, you work on a lot of these techniques also like with Achilles tendonitis or fibrosis. Probably anybody that runs, hey, if you're running over 30 miles a week, probably occasionally you need somebody to do this for your foot just periodically. You don't have to have a tear of the peroneus brevis.
Yeah, ideally this comes first.
Yeah, and then, well said. Well said. I love, when you work with your grass center, are you able to do it on your own, like kind of go around?
Yeah, honestly, I'll do a lot of
or the
same
tool,
the same thing, and I'm not trained either in it, but I'll, you know, for lack of better words, try to dig into to certain spots, and then I'll kind of do those like smooth long strokes just to kind of clear out that area.
Yeah, I think that's the way to do it. And I think using an area like as a reference and then being really thorough and going around it, because you're going to get a lot of the physiology to loosen up. So that's how we approach the foot. We have very similar thoughts on it. But yeah, and it concludes the video for today. Hope you guys like it. Don't forget to like, subscribe, and share. Love you guys.